Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. How are you today? My name is Radya Astari Primanda. You can call me Radya. I am a student majoring in Diplomatry, Blood Bank Technology, Health Polytechnic of the Ministry of Health Semarang. Today, I will present a PowerPoint entitled Blood Donation or Blood Banking. Before that, I will tell you the subject matter of this morning presentation, namely, the definition of blood banking, next, recruitments for blood donors, tests in blood banking, types of blood and components of blood. Let's go to the discuss one. Let's go to the discuss. Let's go to discuss one. The definition of blood banking. What is blood banking? A blood bank is a place where blood is collected and stored before it is used for transfusion. Blood banking takes place in the lab. This is to make sure that donated blood and blood products are safe before they are used. Blood banking also determines the blood type. The blood is also tested for infectious disease. Next. Why might someone need a blood transfusion? There are several reasons why you may need a blood transfusion, such as a sudden loss of blood due to an accident or injury, blood loss as a result of surgery, a low hemoglobin level before, during, or after surgery. Hemoglobin is the protein in red blood cells that carries oxygen. Severe heart, lung, liver, or kidney disease. Bone marrow failure, moderate to severe anemia, decrease red blood cells. Next. Secondly, recruitments for blood donors. Who are the blood donors? Volunteers, blood donors must meet certain criteria. These include, first, must be at least 16 years of age or the minimum age set by state law. Next, must be in good health. Next, must weigh at least 110 pounds. Must pass the physical and health history exam given before a donation. Some states let people younger than 16 or 15 years to donate blood with parental consent. Number third, tests in blood banking. What tests are done in blood banking? Certain standard tests are done in the lab once blood is donated. These include, first, typing. This is blood type. Blood can be A, B, AB, or O. Next, RH typing. Disease can be RH positive or RH negative. Next, screening for any unexpected red blood cells antibodies. These antibodies may cause problems in the person getting the blood. Next, screening for current or past infection. The risk includes hepatitis virus B and C, HIV, human T lymphotropical virus, syphilis, West Nile virus, and Chagas disease. Blood cells are treated with radiation. These kill any T lymphocyte in the donated blood. T lymphocyte can cause a reaction when transfused. They can also cause graft versus host problems. This is a rare complication of a blood transfusion. Blood may also be filtered to remove certain white blood cells called leukocytes. Leukocyte reduced blood. These cells contain antibodies that can cause fevers in the person getting the transfusion. After getting several transfusions, the person may be at higher risk for a reaction. Next, number 4, type of blood. Type of blood groups. Number 1, Blood type A. The surface of red blood cells contains antigen A, and plasma has anti-B antibodies. Anti-B antibodies will attack blood cells containing B antigen. Number 2, blood type B. The surface of red blood cells contains B antigen, and plasma has anti-A antibodies. Anti-A antibodies will attack blood cells containing A antigen. Number 3, blood type AB. Red blood cells have antigens A and B, but plasma doesn't contain anti-A or anti-B antibodies. Individuals with AB blood types can receive any ABO blood type. Number 4, blood type O. Plasma contains anti-A and antibodies, but red blood cell surface do not contain anti-A or B. Since these antigens are absent, a person with ABO blood type can receive this blood type. What are the blood types? There is also a third type of antigen called Rh factor. You may have this antigen, which means your blood type is Rh positive, or you don't have, which mean your blood type is Rh negative. Therefore, out of the 4 blood groups above, there are 8 blood types below, which are O Rh positive, A Rh negative, ARH positive, BRH positive, ORH negative, ABRH positive, BRH negative, and ABRH negative. Next, the components of blood. What are the components of blood? Blood or one of its components might be transfused. Each component serves many functions. Here is a look at each part of the blood and why it might be transfused. First, red blood cells. These cells carry oxygen from your lungs to other body organs. They also carry carbon dioxide back to the lungs to be breathed out, exhaled. The body needs a certain number of these cells to work well. Bleeding due to injury, surgery, or disease may cause a low red blood cells count. This is the most common types of transfusion. Number 2, platelets. This little piece of blood cells help blood clot. Your body may not make enough platelets. This might be due to bone marrow disorders, increased destruction of platelets, or medicine such as chemotherapy. Platelets may be transfused before a procedure that may cause a person with a low platelets count to bleed. Number 3, white blood cells. These cells fight infection by destroying bacteria, virus, and other germs. White blood cells are rarely transfused. They are often set aside as a short-term temporary treatment for people with a low white cells count and severe infection that has not responded to antibiotics. Number 4, plasma. This fluid carries the blood cells all over the body. It contains proteins, vitamins, and minerals. Some of the protein also help blood to clot. Plasma or fresh frozen plasma can be transferred in people who severely lack certain parts of the blood that help with clotting. Okay, that's all from me. Wassalamualaikum warahmatullahi wabarakatuh.